Hi everybody, and welcome back to another episode of For the Health of It. I'm Dr. James Morgan, author of 101 Things Every Person in Healthcare Should Know. And one thing you should know is the topic for today, medication safety. So let's get right into it. First and foremost, keep medication away from children. Making sure it's out of reach, that you have child-proof cabinets, especially for those that have kids that like to get into things now. And make sure that all your medications have safety lids on them. Most of those already come that way anyway, and that usually entails a nice squeeze and twist type of action. But just making sure that those are there for you as well. Talk to your kids. Talk to your kids about medication safety. For example, what if they find a medication on the ground? What do you want to tell them to do? A good tip is just to tell them to leave it there and to get an adult. So those are just some things you want to think about when it comes to children. Now, no medication is 100% completely safe. Everything has its side effects, so make sure you talk to your medical provider about potential side effects, especially if you are on other medication. One rule of thumb when you're taking medication is to stay away from alcohol, because alcohol can increase not only certain side effects, can increase the damage to your liver, but it also can decrease the efficacy of certain medications. So it's just a good rule of thumb, any medication you're on, just try to avoid alcohol consumption. Non-steroidal anti-inflammatory drugs, or NSAIDs, things like your naproxen, ibuprofen, Motrin, Aleve, things like that can cause pretty bad ulcers in the GI tract. So it's always a good rule of thumb to make sure that you eat something with the medication. That doesn't necessarily mean you get to eat a whole meal, but just something enough to coat your stomach, because chronic long-term use of NSAIDs can cause stomach ulcers. Also, making sure that you're aware of things that will mess with the clotting of your blood. Aspirin, for example. Making sure that you stay away from certain medications, especially over-the-counter or herbal medications, that might interact with certain medications that you're already taking that are prescribed that might either decrease or increase your clotting factors. If you are taking antibiotics, make sure you finish your antibiotics. It's one thing to be prescribed an antibiotic for a good reason, but you stop taking it a few days after because you're feeling better. It's always important to finish your antibiotics, because if you stop taking it halfway through, there's a good chance that whatever symptoms that you originally took them for will come back, and usually they'll come back worse. Know the difference between antiviral and antibacterial medication. So antiviral medications are different because they fight against viruses, where the antibiotics, or the antibacterial medications, are effective, of course, against bacteria. And never experiment with herbal products without consulting with your medical provider first, because it can cause some very serious side effects, especially with some interactions with other medications. So that's it for today. Make sure you text the word Dr. James, DRJAMES, to 44222, and I will send you my latest introductory newsletter that's chock full of information, tips and tricks, and even ways to win some free stuff. So check it out. Make sure you text the word Dr. James to 44222. And that's it for today. I'm Dr. James, for the health of it. See you next time.